morning, everyone. Thank you so much for having us here today. We're here to talk about a very important topic, postpartum hypertension. My name is Amanda Brunson. I'm the Director of Community Engagement with Healthy Start Coalition of Southwest Florida. And now I'm going to let the team introduce themselves. Nikki, would you like to start off?
Sure. My name is Nikki Shimko. I am the manager of the critical care transport team at Golisano Children's Hospital.
Hi, good morning. I'm Shaminka Greenidge. I'm the quality manager for women's health at Health Park Medical Center.
Good morning. I'm Jamie Gross. I'm a nurse manager for Lee Health Cape Coral Hospital.
Hello, I'm Lynette Ferry. I'm the nursing director of the mother baby unit here at NCH.
And first, I just want to start off by thanking all of our partners in this initiative. We meet monthly as a maternal work group, and here are all the organizations that take part in that meeting.
Community with working with EMS and first responders. We are bringing you this education to really bring an awareness to postpartum hypertension and the effects it has on the women in our community. And right now, what our ask is for you guys is to really think about, have a mother been pregnant in the last year? And why is this important? What are we here to talk about? Maternal mortality has increased by 62% in the last 3 years. That's a huge increase. Hypertension disorders are the leading cause of maternal death, and 31.6% of maternal deaths have had documented hypertension. So we're going to talk later about what kind of complications happen in this, but it really leads to heart attacks, strokes, organ failure, seizures, which really increases that maternal death.
So where is this all coming from? We are in collaboration with Florida Perinatal Quality Collaborative, that's FPQC, and we are all involved in this initiative for a new state statute which requires participation by maternity units in at least 2 each year in the state of Florida. So this is something you may be seeing in the ER. It's just a poster for educational material and reminding people to ask that question, like Nikki said, have you been pregnant in the past year? With this poster, there are some QR codes for additional education for both the patient or providers. This is, again, just a reminder, and it provides link for additional education.
So now we're going to review some data. Please note that this data is through 2022. We don't have 2023 onward yet. Florida Healthy Charts does not have that information currently available to the public. So when we're looking at the county, for Lee County, the county performance for maternal mortality is in the blue line, and then the state of Florida is in the orange line. So for Lee County, the maternal mortality rate is 13.3. The state of Florida is 15.2. So we're performing under. For Collier County, they're at 0% in terms of maternal mortality. Again, this is from 2022. And Charlotte County, there's definitely some areas for opportunity there. The maternal mortality rate is 95.6. Please note this rate is per 100,000 live births. And just looking at 2010 through 2019 and 2020, hypertensive disorder was the highest cause of maternal mortality at 18.2%. So this really highlights how much hypertension is a problem with our postpartum moms. This is not something to be ignored. It's not just impacting that patient, but it's also impacting that baby and that family. So we really need to pay attention to postpartum hypertension.
Some symptoms of preeclampsia or postpartum hypertension include those new headaches, visual changes, upper epigastric pain, shortness of breath, dry cough, swelling of the hands and the face, rapid weight gain, oliguria, lightheadedness, heart palpitations, elevated blood pressures. And just as a reminder, if you're pregnant or postpartum that has had hypertension and severe headache, to consider a stroke. Now, hypertensive emergencies, we'll talk more about that here. Some hypertensive disorders of pregnancy do affect about 10% of pregnancies throughout the United States, and it's one of the leading causes of maternal morbidity and mortality. It's a leading cause of postpartum readmissions, and it's associated with healthcare and associated with healthcare costs. A blood pressure of 140/90 does require medical treatment. It's considered high. Blood pressure of 160/110 is a medical emergency. Agents used for management of this hypertensive crisis and postpartum period are similar to those during pregnancy, including IV labetalol, hydralazine, and norelnifedipine is a first-line agent.
So now looking at specific campuses, so at Hill Park Medical Center, and this is looking at January through June of 2024, we had 54 out of 78 of our readmissions specifically related to hypertension. So 69% of our postpartum moms that are readmitted are coming back to us for hypertensive issues. Next, looking at Cape Coral Hospital through June, the same time period, we had 16 out of 21 of our postpartum moms coming back with hypertensive issues. That's 76%. So this is actually a very stark piece of data, a huge data point, that the majority of our patients are coming back to us because of hypertension.
So what are we doing to increase awareness? We again have collaborated and come up with a teal bracelet as a medical alert to let you know that this patient or this mom has had hypertension either during their pregnancy or postpartum. It's again a teal bracelet with white letters in bold that say hypertension. We are encouraging our patients to wear them just as, again, awareness and a medical alert to let you know that this was part of their medical history. We are collaborating and working on other ideas such as a wallet card filled out by an RN or provider, even ideas such as something that may incorporate onto their cell phones. And this is just in case they don't think of letting you know or they forget, but to remind everyone that's caring for them that they have had hypertension either during their pregnancy or in the postpartum period. We have distributed these bracelets to both all the hospitals and EMS providers, so you will see them more and more if patients are compliant and wearing them. This next slide is just a short video from the Hear Her campaign, just so you can hear from a patient what they experienced with hypertension.
We also wanted to talk about some initiatives that we're doing individually with our companies. So for our Healthy Start Coalition, all of our home visiting clients have access to their blood pressure cuffs for free. They receive education on nutrition and stress management. At all of our monthly baby showers, we do a presentation on hypertension. And then we also have access to free blood pressure cuffs with a blood pressure station at the events as well. We also have a hypertension portion in our website at healthystartbaby.org. And then we also provide educational materials provided by Lee Health in all of our education patient packets. The American Heart Association is also participating in this. They have secured funding for blood pressure monitors. They are supporting outpatients in settings and join AHA. They are conducting community conversations to increase awareness and health literacy on this topic.
So what are we doing as a health system? So for Lee Health, we are doing patient education. And this isn't just talking to patients about hypertension if they have hypertension. We're trying to make this as very common as knowledge as possible. We're also putting emphasis on providing this education prenatally so that mothers have the seed planted that they can recognize signs, symptoms, and they're not hearing it for the first time if they happen to become hypertensive during their pregnancy. Also, we are connecting patients with community resources such as food banks. Healthy Start has a lot to do with that, as well as the American Heart Association, who's working on providing a script to these patients so they have access to healthy food. We're using technology, remote patient monitoring. So once a patient meets that criteria and they do have hypertension, we do allow remote patient monitoring so that if they have a spike in their blood pressure at home, we could intervene and be more proactive versus reactive. We're working with our electric medical record, or EMR, to incorporate that question, have you been pregnant in the past year, so that patients are appropriately triaged. We're looking at ongoing collaboration with our main emergency departments to provide education so that they have an understanding. Since OB is not their wheelhouse, that's not their realm, they need to have a better understanding so that they treat these patients appropriately. We have been doing presentations at fire stations. We've done it up in Ada Springs. We've done it in Maple. We even did a podcast. So we are out in the community spreading that education. We have recently developed postpartum hypertensive cards to go along with those bracelets. It is available in English, Spanish, and Creole so that the patient just doesn't have this bracelet and an idea of postpartum hypertension, but they have these postpartum hypertensive cards as a point of reference as well. And continuation of the FPQC, Jamie mentioned it earlier, which is Florida Perinatal Quality Collaborative, the PAC Sustainability Initiative. So this is something that is optional because the PAC initiative officially ended on June 30th. This is something that hospitals can opt to do because it still monitors things like doing vital signs in a timely manner, 2 hours or less prior to discharge, and also making sure that that patient has that education for postpartum hypertension as well. So we voluntarily, Lee Health, and that's Health Park Medical Center in Cape Coral Hospital, we volunteered to do this PAC sustainability initiative to ensure that that postpartum hypertension issue for our postpartum moms does not continue to exacerbate, and we are having a good handle on that.
Here at NCH, we have a lot of initiatives that we're taking to bring awareness about hypertension in pregnancy and postpartum hypertension. Our staff continues to provide patient education while they're here in the hospital. We're giving information and packets to go home with. If their discharge instructions include that information, as well as our booklets. We are bringing more awareness with the hypertension bracelets that are distributed with the patients that do have the elevated blood pressures. We've been checking vital signs for all of our patients within 2 hours of discharge. That way we can hone in on those patients that are having those elevated blood pressures and put them on the proper pathways before they go home and get them set up, make sure those blood pressures have evened out. We are also scheduling our patients for follow-up visits with the providers in our community within 2 weeks of discharge for all of our high-risk hypertensive patients. Healthcare Network, what they're doing to help the community and bring awareness is working with the providers and the clinical staff to identify diagnosis of elevated blood pressures at the time of their prenatal or their postpartum visits and at discharge from the hospital. Once they identify them, they're able to refer them to their OB telehealth program. The patients are provided with education on hypertension that include all the different signs and symptoms of preeclampsia. They're instructed on the guidelines to make sure that they're within their ranges and when recheck should be completed. Once they're out of range, once the blood pressures are out of range, the patient is contacted and given instructions in the protocol to follow.
What we're doing to work together is, as I mentioned earlier in the presentation, we meet monthly as a maternal health work group just to discuss our progress, our challenges, and share best practices with one another. We talk about the distribution of the bracelets, look at new opportunities where they can be distributed. We're constantly looking for new materials to further the mission. We're educating the public on the importance of postpartum hypertension. When the FPQC Prompt Initiative starts in October, we will then go out into the community to the emergency departments and to the urgent cares and try to educate them on this topic. We make sure that the moms and babies we serve are receiving the best care possible. And for FPQC, we also sit on the ER, EMS ad hoc committee.
So bringing this all back together, why did we start having this conversation? Why are we here today again? It's really showing you the data to say it is a problem in our area, and for you guys as first responders to really start to recognize that a high blood pressure could be related to a postpartum, and helping us recognize it early on and getting them to the emergency department for treatment. There are conversations happening behind the scenes regarding the protocols for you guys. You know, right now it's MAG for treatment for patients with high blood pressure, with headaches and that. So really kind of getting to know some of those signs and symptoms, identifying the blood pressure right now, and then future, we're going to look at what does that protocol look like for you guys as far as potential treatment for this blood pressure and stuff. And Amanda just mentioned, we are part of the state collaborative that is really looking on EMS guidelines across the state to really give the medical directors guidance from an OB side of things as well, to really give you guys the best evidence treatment for these patients. But for now, if you can just start asking when you realize that they have a higher blood pressure, have you been pregnant in the last year? And then this will help us get them proper treatment from the start in the ED.
We just want to say thank you so much for having us today. We appreciate this opportunity to speak to you about this important topic. And Matthew knows how to find all of